fallen leaf appearance is the name which is provided to, which is the X-ray finding for simple bone cyst. But don't utilize these theoretical appearances to identify the tumor on the given X-ray. For the purpose of identification, you have to rule the other options out based on the knowledge which were provided to you in the forms of the tables. All right. So it will become much easier for you to identify that what is the name of the tumor that you are visualizing at. So this is how the simple and the aneurysmal bone cysts are identified. Next, whenever you are provided with the X-ray of any region of the hand and they are asking anything related to the tumor, then you can safely go with the differential, or you can go with the answer of enchondroma. You know what we have seen, that enchondroma is the most common tumor of a small bone in hand. It is a benign tumor, metaphyseal tumor, a lytic lesion, which will result in the degeneration or disintegration of that particular region of the bone. So enchondroma, whenever you are provided with the X-ray of the hand and they are asking anything related to the tumor by marking it, answer for that question most likely is enchondromatous tumor or enchondroma. Next, onion peel appearance is something which we have already talked about by giving you the examples of how this periosteal reaction gets arranged in the form of its layers, and this layer, when gets more and more calcified, will appear like a peel on the X-ray. So this onion peel appearance, that means presence of the periosteum beyond the confines of the normal bone in the diaphyseal region, is the X-ray which is suggestive of Ewing sarcoma. All right. So this is again much easier for you to identify. So this location of the tumor is also very important. Like in case of enchondroma, it is a metaphyseal tumor, so it will be appearing in the metaphyses. In case of simple and aneurysmal bone cyst, both of them are metaphyseal, and here also you can see, or you can confirm it to be a metaphyseal tumor. In case of osteochondromatous tumor, this is also again metaphyseal tumor. So in the distal end of the femur metaphysis, this tumor is getting outpouched from. So this is how you will identify and relate with the locations of that particular tumor. Next, punched out lytic lesion. You know, punched out or a large lytic lesion in the skull or multiple lytic lesions in the lumbar vertebrae are going in the favor of multiple myeloma. So this is nothing, or identifying this kind of a tumor is not a task, because simple punched out lytic lesions of the bone, punched out lytic lesion of the skull goes in the favor of multiple myelomatous tumor. Next, you know, we have talked about X-ray finding, which is considered to be diagnostic for that particular tumor. When we were writing about the X-rays in the given in the provided table, then you have written that if there is a presence of a small radiolucent nidus within the long bone confines of the cortices, it goes in the favor of osteoid osteoma. So this is that a small radiolucent nidus within the long bone cortex in the diaphyseal region. So this is how the osteoid osteoma lesions looks like. And when you see this kind of a circular radiolucent small lesion within the cortex of the long bone, it is certain, it is diagnostic for osteoid osteomatous lesion. All right. Now, Shepard-Crook deformity as well as ground glass appearance, both of them goes in the favor of fibrous dysplasia. Now, this is something which is means this Shepard-Crook deformity in particular, they can ask. It appears like a stick of a shepherd. All right. So this Shepard-Crook deformity, that too seen more commonly in case of proximal end of the femur. So this Shepard-Crook deformity as well as ground glass appearance, both of them goes in the favor of fibrous dysplasia. Next, now in this case, before we talk about that it is the X-ray appearance of which tumor, you have to identify that what are the structures which are visible and what are the structures which are left out. Now in this particular, you have to understand that what is the significance of this kind of the X-ray. Now in this case, you are visualizing the five of the vertebrae. Now imagine this is first, this is second, this is third, fourth and fifth. All right. So these are first, second, third, fourth and fifth vertebrae. Now what is happening? If you look at this, these are the pedicles of the vertebrae. So this is a pedicle. On the other hand, if you look at this structure, this one is the spinous process of the vertebrae. All right. Now, if you combine both of them, then it appears like a face of an owl. This entire anterior-posterior view of the vertebrae appears like a face of the owl. Now, in this vertebrae number 1, both the eyes of the owl, that means both the pedicles are clearly delineated, they are visible. Similarly, in case of vertebrae number 2, both the eyes are clearly visible. In case of vertebrae number 4, both the eyes are visible. In 5, both the pedicles or the eyes are visible. All right. But in case of vertebrae number 3, what is happening? That one of the eye is visible, but the other eye is not visible. That means other of the pedicle margins of the pedicles cannot be delineated. That means if you look at this face of this owl, of the third one, then one of the eye is blinking, one of the eye is not visible. That means one of the eyes seems to be winged, and this is what is known as winking owl appearance. And you know what the winking owl appearance is? That one of the eye is closed. Winking owl appearance is a feature which is suggestive of secondaries in the vertebrae. All right. And you know, the most common site for these secondaries to be identified in is the vertebral column. So winking owl appearance as well as blind bat sign, both these two X-ray findings you have written in case of your long X-ray appearance table, and both of them goes in the favor of a secondary. All right, winking owl appearance as well as blind bat sign. Now, what is blind bat sign? Imagine when both the eyes of the owl, that means both the pedicles of the vertebrae are not visible, then it would be called as blind bat sign. So both goes in the favor of secondaries. Next, when you see a vertebral body where the striations of the cortices, it appears like a bars of the jail, then it would be called as a jailhouse or a corduroy appearance. And this jailhouse appearance of the vertebral body is a feature of vertebral hemangioma. All right. So this is again what you have written, that jailhouse appearance or a corduroy appearance is a feature of vertebral hemangioma. So this is how you will identify the X-rays, and this is how you can correlate whatever you have learned in the theory to mark the correct answer if you are provided with the X-ray of a particular tumor. Most of the time what you get in your question, if you go with the quick revision, what you get most of the time in your question is a giant cell tumor. You know, most of the time you get the epiphyseal tumor in the question for the purpose of identification, and it is very easy. You look for the epiphyseal tumor, then the second thing you have to look for is the growth plate. If growth plate is visible, chondroblastoma. If growth plate is not visible, GCT. You know, as far as malignant tumors are concerned, you are more likely to get osteosarcoma, Ewing sarcoma in the form of the X-rays, because they can easily be identified. Yes, be ready for two of the benign tumors like osteochondroma as well as osteoma or to be asked in future. Simple and the aneurysmal bone cyst are to be delineated or are to be differentiated from each other. As far as Ewing sarcoma is concerned, onion peel appearance, which we have already talked about. Now, this fibrous dysplasia related questions is going to be delivered in the form of a Shepard-Crook deformity more commonly. Whenever you are asked the tumor related to or tumor related question in favor of secondaries, then with this X-ray, you are going to get a long theoretical assistance, all right, where there could be a breast cancer, there could be a thyroid cancer, there could be renal cell carcinoma, which metastasizes to involve the bones secondarily, all right. So be prepared for at least 1 to 2 questions in every examination based on the X-ray appearances of the tumor. So hopefully everything is clear related to the particularly important topic, that is musculoskeletal tumors in particular. Thank you.